Hello, my name's Amanda, and this is my presentation for my BCIT Breastfeeding Experience Theory course, NSPN 7155. In this presentation, I will be applying the Situated Clinical Decision-Making Framework to the context of two breastfeeding challenges, engorgement and twins. I want to start with a little fun fact about myself. I'm a twin. So that's a picture of me and my twin brother Dan. And here's another picture of me and my twin brother Dan. The topic of twins hit close to home for me and definitely made me appreciate the challenges my mom faced when she was breastfeeding the two of us. So let's start with the Situated Clinical Decision-Making Support Framework. As you can see, knowledge is in the middle, then there's cues, judgment, decisions, and evaluation of outcomes. Applying them to each of the breastfeeding challenges hopefully will facilitate an understanding of how this framework can be used to support decision-making in complex contexts and situations. We'll start with knowledge. In order to make the best decisions, we have to have a baseline understanding of the breastfeeding challenges before we can consider how they might impact the breastfeeding experience. Twins. Twins can be defined as two children or animals born at the same birth or something consisting of two matching or corresponding parts. There are two types of twins. Identical twins are monozygotic, meaning they develop from just one zygote that split to form two embryos. Fraternal twins, like my brother and I, are digazotic, meaning we developed from two different eggs that were each fertilized by separate sperm. Engorgement. Engorgement can be defined as the swelling of breast tissue brought about by an increased blood and lymph supply to the breast as they produce milk. It is considered a common response to the sudden change in hormones, a drop in estrogen and progesterone, and an increase in prolactin that cause a significant increase in milk production. Engorgement usually occurs 3 to 5 days after birth and can be associated with the milk coming in. If the milk is not adequately removed, the alveoli become distended, capillary blood flow is compromised, and as the congestion worsens, fluid leaks into the surrounding tissue. This edema compresses the milk ducts, impairing the ability of milk to flow from the breasts. Cues. Cues refers to observations around how the challenge is affecting the breastfeeding experience and the client's attitude about breastfeeding, as well as assessment and findings that are a result of the challenge. Breastfeeding multiples can be twice as overwhelming and exhausting, and it requires a lot of dedication. My mom expressed how hard it was because Dan and I had such different eating patterns, and especially at the start, she felt like her whole life consisted of feeding us. The feeding relationship can be immensely affected if a mother comes to associate breastfeeding with negative feelings. Juggling two can lead to even more exhaustion, feelings of inadequacy, and other adverse effects that come along with additional emotional and physical demands. Some of these include early cessation of breastfeeding, burnout, and physical problems like sore nipples and engorgement. As seen in these cartoons, as well as pictures from previous slides, physical symptoms of engorgement can include red, firm, and tender breasts, heat, and taut skin. The breasts become very heavy and painful. Engorgement can lead to infection, and mastitis is just another complication that can be a barrier to breastfeeding. The feeding relationship can be affected because engorgement can cause difficulty latching and potentially even diminish milk supply, because the pressure of being full inhibits the milk production. This can not only deprive the infant of the benefits of breastfeeding, but can also be a devastating consequence for the mother's self-esteem and feelings towards the experience. Judgment. After thorough assessment and data collection, deciding how to support the client involves judgment about what is happening, what are the factors, and what are the priorities. As it is important to consider all aspects of the client's situation, it is also important to involve those best able to help. For example, consulting other healthcare professionals, resources, and family and friends. In regards to both of these breastfeeding challenges, I think the most important aspect is to maintain balance between the supply of milk and the demand for milk. This can be achieved by following the 3 breastfeeding rules: feed the infant, move the milk, and support the dyad to learn how to breastfeed. Decisions. How can we help mothers feed their infants effectively despite these breastfeeding challenges? By explaining and supporting them through the 3 priorities of feeding the infant, moving the milk, and teaching the dyad to breastfeed. Priority 1 is feeding the infant. In regards to nursing twins, this means ensuring that both infants are getting enough breast milk to thrive. There are many ways to modify breastfeeding to accommodate 2 infants, such as the double clutch, double football, double cradle hold, and others as seen in these pictures. At first, mothers might breastfeed one at a time to establish a rhythm with each infant, but later they might choose to nurse both at once in order to save time. It takes a while to figure out what works best for all 3 involved, and as long as everyone is comfortable during the breastfeeding experience and is thriving, priority 1 is accomplished. Priority 2 is moving the milk. This is a huge factor for mothers, especially those with twins, who are worried about not having enough milk. Although breasts are never actually empty, it is during the feeling of emptiness that milk production is promoted. Breastfeeding when babies cue and potentially expressing in between if breasts are feeling full will promote milk production as well as help prevent engorgement. Pumping during engorgement does not actually make the problem worse by increasing milk supply, but instead helps to treat the problem by moving the milk. Mothers with engorgement are encouraged to breastfeed often and increase duration if possible. Other treatments, such as raw cabbage leaves and cold compresses placed on the breast, anti-inflammatory medications, and supportive bras are ways to treat engorgement and help mothers to comfortably move the milk. Helping the dyad to breastfeed is priority number 3. Whether it's the pains of engorgement or the struggles of nursing twins, the basics of the 3 E's, early, effective, and exclusive breastfeeding, are key when helping the dyad learn their rhythm and become in sync. Skin-to-skin contact, a calming environment, alternating breasts, proper supplies and pillows, and listening to baby's cues are just a few strategies that can facilitate positive breastfeeding experiences. However, no matter what the situation, having family and friend support, as well as healthcare providers the client trusts, are instrumental in supporting priority number 3. Evaluation of outcomes. This is the final component of the decision-making framework, and it is important in order to understand the effectiveness of interventions. It is also key to support the mother in her ability to evaluate the decisions herself. Is she more comfortable breastfeeding? Does she have more confidence? Have her symptoms subsided? Are the infants thriving? These are just a few questions one might pose during this phase of the decision-making framework in the context of breastfeeding. That concludes my presentation. I have identified the 3 main priorities of feeding the baby, moving the milk, and helping the dyad learn to breastfeed. Also, I hope that you enjoyed my application of the Situated Decision Clinical Making Framework in the context of the 2 breastfeeding challenges, engorgement and twins. Thank you for watching.